Imagine waking up with a pounding headache again. How many of you are part of this silent majority trying to navigate your day through the fog of pain? Headaches. They're far more common than we'd like to admit. A throbbing temple, aching forehead, or a vice-like grip at the back of your head, these are battles many of us wage every day. They disrupt our daily routines, hinder our productivity, and can even affect our mood and relationships. But headaches are not mere annoyances. They can be the body's way of raising a red flag, indicating underlying health issues. It could be as simple as dehydration, or as complex as a neurological condition. It's not just about popping a pill and hoping the pain subsides. It's about understanding what our body is trying to tell us through this pain. It's time to understand our headaches better, to fight them more effectively. Ever thought that not all headaches are the same? Yes, headaches come in different types, each with its own set of symptoms and causes. Let's start with tension headaches. They're the most common type and often feel like a tight band around your forehead or at the back of your head. It's a constant, dull ache that tends to occur after long periods of stress or staring at a computer screen. So, if you're often saying, "My head's in a vice," you're likely dealing with a tension headache. Next up, migraines. These are the bad boys of the headache world, notorious for their intensity and often accompanied by nausea or sensitivity to light and sound. Unlike tension headaches, migraines are usually one-sided and described as a throbbing or pounding pain. They can last for hours and in some cases even days. If you're frequently incapacitated by severe headaches, migraines could be your culprit. Then we have cluster headaches. These are less common but incredibly severe. They're usually felt around one eye, and that eye may become red, swollen, or start to tear. Cluster headaches are so intense that they're often referred to as suicide headaches. They tend to occur in clusters, happening around the same time each day for weeks or months, then disappearing for a while. Lastly, sinus headaches. Often confused with migraines, these headaches are associated with a feeling of pressure in the area of your sinuses. They're usually accompanied by other sinus symptoms like a runny nose, fever, and facial swelling. If your headache gets worse when you bend over or lie down, you might be dealing with a sinus headache. Each type of headache has its own pattern, its own rhythm, and its own set of triggers. Understanding these differences can help you determine what's causing your headache and, importantly, how to manage it. Recognizing the type of headache you're experiencing is the first step towards finding relief. Now that we've identified the enemy, how do we combat these headaches? Let's start with tension headaches, those pesky intruders that feel like a tight band around your forehead. Simple lifestyle changes can work wonders. Regular exercise, a healthy diet, and adequate sleep are your first line of defense. Over-the-counter pain relievers such as ibuprofen or aspirin may also provide relief, but remember, moderation is key. Then we have migraines, those debilitating headaches often accompanied by nausea and sensitivity to light and sound. Here, a two-pronged approach can be beneficial. First, identify and avoid your triggers. These could be anything from certain foods to changes in sleep patterns. Second, learn and practice relaxation techniques. Deep breathing, yoga, and meditation can help manage stress, a common migraine trigger. Cluster headaches, those intense and piercing headaches, often require a more aggressive approach. Over-the-counter medications may not be enough, and it's recommended to see a doctor. Prescription medications and oxygen therapy are commonly used treatments. Lastly, sinus headaches, often mistaken for migraines or tension headaches, are generally associated with a sinus infection. Warm compresses, steam inhalation, and staying well hydrated can help relieve the pain. Over-the-counter decongestants may also be useful. However, if symptoms persist, it's time to consult a doctor. In the end, it's essential to listen to your body. If headaches become frequent or severe, don't hesitate to seek professional help. Chronic headaches could be a sign of an underlying health condition. Moreover, it's crucial not to overuse pain medications, as this can lead to rebound headaches, a cycle that's hard to break. Remember, understanding your headache is half the battle won. The other half is about taking appropriate action. But wouldn't it be better if we could prevent these headaches in the first place? Indeed, prevention is key. Regular exercise not only keeps your body fit but also helps in reducing tension, a common headache trigger. Adequate hydration is another vital step in preventing headaches. A balanced diet that includes all necessary nutrients can also ward off headaches. Lastly, good sleep hygiene, a regular sleep schedule, and a calm sleeping environment can help keep headaches at bay. In the end, prevention is the best cure. Headaches might be a common ailment, but they don't have to rule our lives. We've explored the many faces of headaches, from tension to cluster and migraines. Each type demands a unique battle plan, and we've discussed how to deal with these pains on our own. The key lies in understanding, prevention, and proactive health management. Remember, when it comes to your health, you're in the driver's seat. So go ahead, arm yourself with knowledge, and take the first step towards a